Hello, everyone. Good evening, everybody. I'm Riddhi from Prostate Wellbeing. I'm sure all of you must be keeping good health. Today, we are going to discuss a very important topic, that is renal calculi. Renal calculi or kidney stones are hard, pebble like pieces of material that form in one or both of your kidneys when high levels of certain minerals are in your urine. Kidney stones vary in size and shape. They may be small as grain of sand or as large as a pea. Rarely, some kidney stones are as big as golf balls. If you have symptoms of kidney stones, including severe pain or bleeding, seek care right away. A doctor, such as urologist, can treat any pain and prevent further problems, such as urinary tract infections. To more throw light on the subject and guide us on what's right for diagnosis and treatment of renal calculi, today we have with us renowned urologist Dr. N. Satya Prasad, MS MCH Urology. He has an experience of more than 10 plus years and has hands-on expertise in urology, BPH, and stone management. He is currently practicing at Satya Kidney and Multispecialty Hospital, Rajahmundry. Dr. N. Satya Prasad has rich experience in the field of urology and carries out the renal calculate diagnosis and treatment with utmost precision and efficiency, ensuring that patients' health is in safe hands. Over to you, doctor. What are the kidney
Good
stones?
evening. Yeah.
What
So
are
you
kidney stones?
as already you told, no, there will be like kidney will filter all the bad material and some minerals, urea, citrate, and potassium, magnesium, calcium, and all these things will get, they will go through the urine. So if these minerals get deposited, and they can form stones. So this would be uh, a normal process in some individuals, wherein these stones get deposited, and they will increase in size, and they will cause problems depending on the size of the stone. So everyone need not to have the same problem, but it depends upon the individual genetic factors also and diet habits.
Doctor, what are the symptoms of kidney stones?
Yeah, if stone forms in the kidney, it will block the kidney and it will cause severe pain. Sometimes it also causes fever, but usually it is associated with pain, voiding difficulty. There will be problem with micturition, voiding the urine, and also vomiting will be there, fever will be there, and the pain is very severe, excruciating pain will be there, which will make the patient not to sit or sleep or do anything. So this is the typical type of kidney pain. But remember, this is the majority symptoms will be like that. Sometimes there would be silent stones also. Sometimes they can present as kidney infection. Sometimes they can like urine infection. Sometimes they can happen like a simple fever. So we should have suspicion when some symptom is not going well. Sometimes they present like simple voiding problem, like urine problem. So, but majority of the time, it is the renal colic will be there. There will be severe pain. Okay.
Doctor, what are the main causes of kidney stones?
Yeah. Most of the times in our area, it's like diet is an important thing. And next important thing is the water intake. And the third important thing is the genetic factors that are associated. So people who work outdoors, who don't take much water, there will be a dehydration. In the dehydration, the urine pH will change, and acidic pH stone crystallization will be more. And also high protein diet also alters the pH. And also protein diet, there will be high uric acid, and it can cause stone formation. And other dietary factors like oxalate rich foods. Some foods will have high oxalate, like tomato, palak, grapes, and chocolates. And these all will have high oxalate content, and they can cause stones. And and we can say a lot of things in our area can be attributed to the diet and water intake. The rest can be seen with the recurrent stone formers, whoever forms stones yearly. It
Hmm.
can be due to like genetic aspect.
Hmm.
The diet is important thing.
Hmm.
Yeah.
Doctor, what removes renal calculi?
What?
What removes renal calculi?
Water removal.
Hmm.
I say water, drinking water.
No, no. What removes renal calculi?
Okay, yeah, that's an important thing. When stones form, no, they become into small crystals.
Hmm.
Okay, crystals of they will increase in size slowly,
Hmm.
and usually about the stone size will be about 4 to 7 or 8 size. Most of the time, stones below 5 will pass spontaneously with the water intake.
Hmm.
Okay, they will come out in the water. But any stone, especially about 8 millimeter in size, it is difficult to come out. It
Hmm.
needs some medical expensive therapy or a surgical intervention.
Hmm.
Yeah.
Doctor, when should one seek a doctor?
See, any patient with pain, they can't stay at home. I told you, it's a very severe pain.
Hmm.
So pain, fever, vomiting,
Hmm.
and any known patient of renal stones, if they get episode,
Hmm.
also they could be get alerted.
Hmm.
Any diabetic, especially any diabetic patient with
Hmm.
stones, they have to seek medical help immediately.
Hmm.
And any patient with single kidney, like congenital single kidneys will be there. So, or a single functioning kidney, they have to, meet the doctor immediately.
Doctor, what type of individuals can majorly can have kidney stones?
So, there is nothing like what type of individuals, but anyone can have stones.
Hmm.
But if you say like family history of stones
Hmm.
or personal history of stones, because 50% recurrence rate of stones will be there in 10 years if a patient get a stone. So
Hmm.
they are high likely that they can get. The prevalence of stones is also very high in our area. It is around 5 to 20%. So 5 to 20% of the population can get stones.
Hmm.
And if you specifically ask which patient may get stone,
Hmm.
then obese patient can get stones more often than non-obese patient.
Hmm.
Patient with hyperuricosuriia, that means you have problems with uric acid metabolism, they can have stones.
Hmm.
Patient with high salt intake can have stones. So, and patient who take high protein
Hmm.
intake,
Hmm.
they can also have. These are the specific types.
Hmm.
And other genetic conditions are like those who excrete high calcium, hypercalciuria conditions, or those who have uric acid metabolism conditions.
Hmm.
All these patients can also oxalate metabolism conditions. They can have stones, and cystinuria is one condition. They can have stones specifically if you ask. But 5 to 20% of the general population,
Hmm.
stones can occur.
Hmm. Okay.
Yeah,
Doctor, what are the prior precautions and preventions to be taken care to avoid kidney stones?
yeah, definitely. If you are careful enough, you can avoid kidney stones. The first and foremost important thing is water intake.
Hmm.
Okay. So people don't know how much water to take. If you are a stone patient, how much water you have to take,
Hmm.
people don't know.
Hmm.
We have to drink water in such a way that your urine output, the amount of urine you excrete daily, should
Hmm.
be between 2 to 3 liters. That
Hmm.
means your water intake should be over and above that, like 3 to 4 liters. It should be
Hmm.
okay. That's the first and foremost important thing. Second thing is to be careful during summer seasons. To
Hmm.
be careful during summer seasons.
Hmm.
Okay, especially when you are having dehydration and everything.
Hmm.
Uh, and in that season, you have to take more water. Or if you are already a stone patient, be careful.
Hmm.
And you can take urine alkalizers,
Hmm.
and you can avoid protein food, non-vegetarian food during summer, and you
Hmm.
can prevent stones.
Hmm.
So, preventive aspect is mainly about diet. You
Yeah.
should know what you eat. What should you eat? A stone patient should eat. So if you're given a preference of mango and orange, a stone patient should prefer orange because orange will decrease stone formation.
Okay.
So if you are given a option of thumbs up and a lemon juice, so you should prefer lemon juice instead of thumbs up because thumbs up can cause stone formation. And refined sugars, especially about diet, refined sugars can also form stones. And important thing is salt. Many people won't take salt into consideration. High salt in diet can also cause problems. So
Doctor,
patient with
mentioned.
stones should have clear-cut idea about that diet, what to take. They have to avoid high protein diet. If at
Yes.
all they want to take non-vegetarian, they can opt to fish with lesser quantities. Okay. Yeah, the recommended protein intake for a stone patient is 52 grams per day.
Per day.
Okay. You should not take more than that. Okay.
Yeah. Doctor, diagnosed patient of having kidney stones. So, is that possibilities having more of citric food can help reduce kidney stones, as you mentioned, like in one of the
Yeah.
answer?
Yeah. Definitely. Definitely. Especially it comes to diabetic patients. They're already on diet. So it and problems will be more for the diabetic patients. So taking regular citrus foods or citrus drinks like lemon juice and everything, they can avoid stones.
Doctor, which are the food intake one should have if the person is diagnosed with kidney stones?
No, I already told you, no. So what diet they have to avoid, I will tell you. Nowadays, many people are doing diabetes reversal program, diet programs, keto diet, low carb diet, and everything. So this keto diet type of things are not good for kidney stone patients because it has high protein diet. To tell you the exact diet, you have to avoid tomato, palak, and this uh, fruits like grapes and uh, should take like pineapple. It is good for health, and cashew nut and groundnut you should avoid. Okay, so lettuce you have to avoid. These will have high protein and this uh, oxalate content, and they can cause stones.
Doctor, how can
Okay.
one pass a kidney stone? Rather being taking
Yeah,
a
I
surgery
already
or
told
anything,
you
how can
stones
one
below.
pass?
Yeah, stones below 5 mm will pass through the tube, ureter tube, but the bigger stones may not pass. And the tube, that is the ureter tube size, the diameter, is not same for everyone. Some patients, even 1 centimeter stone may pass away. But even for some patients, 4 mm stones will strike. There is no hard and fast rule, but the percentage is if stone is below 6 mm, 80% you can pass. But if it is above that, uh, 6 centimeters, spontaneous passage chances is very less unless you take some medication. Yeah.
Doctor, how long does it take to pass a kidney stone?
Again, it doesn't, there is no hard and fast rule for that.
There's
But
no specific
with
time.
specific time,
Yeah.
it depends upon it varies from individual to individual. So if the ureter diameter is large for the patient, you can pass. But usually we take conservative treatment. If we are giving medications, we'll see for 6 days to 2 weeks, and then 1 week to 2 weeks we'll see for the patient. Again, we have to watch for the other symptoms also. Like if the patient is having fever, if he's having severe pain, if he's having vomitings, he's having voiding difficulty, the patient has diabetes and uncontrolled sugar, the patient has having single kidney, then we won't wait for a longer period. We will do the surgery. Okay.
Yeah. Doctor, what are the treatments available for kidney stones?
Yeah. For the smaller stones, we will give medical expulsive therapy. We give medications like tamsulosin, tamsulosin or deflozacort we can give, and we can give stone syrups like urine alkalizers, potassium citrate syrups with B6 combined, and we can give oral fluids. IV fluids we will only give for the patient who cannot take uh, oral fluids. If he is having vomiting, then only we'll give IV fluids. Otherwise, oral fluids is better. If it's non-diabetic, coconut water is better to take. It promotes urine output. Okay, and other options are surgical options. We can broadly divide into two type of surgeries. For the bigger stones in the kidney, for the stones in the ureter, and for the stones in the bladder. So for the stones in the bladder, we can pass a scope and we can break the stones. That is called cystolithotripsy. For the stones in the ureter tube, we can do URSL or RARS, that means laser surgery. For the stones in the kidney, which are big or small to moderate size, we can do laser surgery, that is RARS. For the bigger stones, which are filling entire kidney, we can do PCNL surgery. We will make a small pore and we can clear the entire stone burden. So with the advent of new lasers and powerful lasers, we are now almost more than 90% we are clearing the stone from the RARS method. That means we will retrogradely pass equipment like that is camera with the working channel from the urine passage camera from the reverse direction, and we'll go up into the kidney and we locate the size kidneys, locate the kidney and number of the stones, how many are there, and we will fragment the stone, we'll powder them, and we'll remove them. Okay.
Yeah. Doctor, do kidney stones form in one or both the kidneys?
Can form in one or both kidneys. Yeah. Usually both kidneys there will be.
Doctor, what advices would you like to give to the patients who have already been into kidney stones, have treated themselves, and are there any chances that they'll get kidney stone again?
Yeah, definitely. I told you earlier, there is a 50% chance of recurrence in 10 years period. So
Okay.
that means you should be always vigilant and you should be always careful. My patients usually what I see is they will careful after surgery for 6 months to 1 year maximum. Then again they will start eating everything and they will get stones again. So you should be careful whenever the summer months come where temperature is very high. There is a high likely chance of getting stones. So in that months we should be very careful. And water intake and diet management is a must. So without following all these things, we cannot avoid stones. Somebody messaged me that his coffee will cause stones. It's definitely tea coffees will increase the uh, stone instance.
Doctor, how can one prevent future stones?
Yeah, again, we are discussing that again and again actually. Prevention is the diet, exercise, okay, and diet, exercise, and water intake.
Yeah. Doctor,
Important.
do all stones require surgery?
Yeah, definitely. Some there are different definite indications like severe pain, vomiting, and fever. If the patient has, we have to do it. And size of the stone, size is the bigger size, we have to do it. And sometimes stones will be there in both kidneys, obstructing both kidneys, leading to kidney failure. Then we have to do it. And sometimes some patients will have a single functioning kidney or congenital single kidney. That means they will have only one kidney. Then, in that, if you don't remove the stone, the patient will go into kidney failure. So these are the absolute indications. We have to do them. Okay. And the preventive aspect you asked, no, for the recurrent stone formers, those
Yes.
who are forming stones again and again, and those who are getting stones in a childhood, that means very younger age group. You have to do metabolic evaluation
Mhm.
and see how the calcium, uric acid, oxalate,
Mhm.
and citrate levels are there in the urine and also in the blood. And we have to take care of, we have to see other causative factors like parathyroid gland enlargement and any cysteinurias like cystine metabolism abnormalities. And we have to see like this, any uric acid metabolism changes are there. And
Mhm.
if we correct that, we can avoid stones in them.
Mhm.
Okay.
Yes, yes. Doctor, how much fluid should a person drink to prevent kidney stone formation? Because there is a lot of time happens that people do intake fluid, as you mentioned, 3 to 4 liters of water, but the output, that means the urinary time period, is very much less. They tend to hold urine. So, what advice would you like to give, and what should be done by those individuals?
Yeah, that urine, we should drink fluid
Hmm.
in such a way that you should get 2 to 3 liters urine output.
Hmm.
Then it varies from individual to individual.
Hmm.
Some people may get, if they drink 2 liters, they will get 2 liters urine.
Hmm.
Some people may not get the same amount if they have more sweating and everything.
Hmm.
And also, it depends on the working condition also.
Okay.
If you are doing an outdoor work or hard work,
Hmm.
you need more water.
Yeah.
Okay. But the dictum is that make sure that if you are a stone patient, make sure that your urine output is more than 2 liters.
Hmm.
So for that, how much you have to drink, it varies individually.
Hmm.
Okay, but you have to see that your urine output should be more than 2 liters.
Okay. Okay.
Yeah.
Doctor, the session has been very informative. We have viewers along with us who wants to ask questions.
Yeah.
We have Manoharan, whose question is, will coffee intake makes more kidney stone formation?
Yeah, definitely.
Hmm.
But if you are a stone former, then you have to take care, like not increase. See what the diet I told you earlier
Hmm.
is not that you have to avoid them completely.
Hmm.
You have to decrease them, decrease intake of them.
Hmm.
Coffee once in a while won't make you, immediately stones won't form. But high intake, large quantity of coffee intake may cause
Hmm.
this thing. Yeah.
Doctor, what are the tests available for kidney stones, and what are they called?
Yeah. Test set, we can do an X-ray, ultrasound, CT scan.
Hmm.
If you ask me single best test to rule out, it is a CT scan.
Okay.
It gives the exact size, location, and number and everything. But again, it is associated with radiation.
Hmm.
So we will start with like basic ultrasound,
Hmm.
and we'll see about the. We can get an idea of number of stones, location, size, and everything.
Hmm.
So ultrasound is a basic and best test. If you want to tell me the single best test, then it is CT scan. It is fast and will give you the accurate investigation,
Hmm.
accurate assessment.
Hmm.
Yeah.
So you mean to say the safest is the
Ultrasound.
ultrasound, and the quickest is CT scan.
Quick and accurate is accurate.
Accurate. Yeah. Okay. All
Accurate
right.
is
So we have Suresh Kumar with us. This question is, are there any preventive measures or medications that can help reduce the chances of developing prostate issues?
okay. You mean prostate or prostate issues? Because if you are a man, you'll get your prostate will increase with age. That's a dictum. But to prevent prostate problems like increased size and associated symptoms, then we can do an ultrasound, check the size of the prostate, and we can use medication. There are good medications which can avoid problems with benign prostatic hyperplasia, BPH. And for to avoid prostate cancer, then you have to do a serum PSA test, wherein we'll check the PSA levels. The PSA levels are high, more than 4. Then we'll do other tests to confirm the prostate cancer. If you diagnose early, we can treat it in the early stage. And coming then this prostatic abscess may be seen with some conditions of diabetes
Mhm.
or urethral problems and everything. That's a different issue. That is a different issue.
Yeah. Thank
Okay.
you, doctor. Doctor, which kidney stones are risky and what are the symptoms and how it is treated?
Which kidney stones are risky? There's nothing like that. Uh, as again, I told you, like if it is small oxalate, calcium oxalate monohydrate stone, it may pass out easily. Calcium oxalate monohydrate stones are very hard, and the stone is like with spikes like thing, and it will cause more pain. Okay, like that we may say, but there is nothing like that. Even a uric acid soft stone can also block the kidney and can also cause the same amount of problem for the kidney. With the degree of pain may vary. Yeah.
Thank you, doctor.
Again,
Uh,
because you know, I tell you one thing, which stone
mhm.
is dangerous? No, the
Mhm.
stone which doesn't cause pain is dangerous. It will silently destroy the kidney. If
Oh,
you are a stone patient, then it's better you check how the kidneys are once in a while.
mhm. Mhm. Okay. All right, doctor.
Mm.
Doctor, as you mentioned, silent stone. So, how one can get to know that the person is diagnosed with a silent kidney stone?
Mhm. Yes, come again.
Uh, yeah. Just wanted to ask, as you mentioned about the silent kidney stone. So, how can one get to know that person is diagnosed with silent kidney stone, as it doesn't cause any pain? So, what are the other symptoms we can just check on so that we get to know?
Yeah, these patients will have urinary tract infections.
Hmm.
Urine infections will be there. They
Hmm.
can have low grade fever,
Hmm.
and usually these people may have a history of stones.
Hmm.
So anything, there some have they may present like low back pain,
Hmm.
back pain. Okay, so they will have back pain or
Hmm.
a vague particular kidney stone pain. It might not be there, but there is a vague pain will be there. Pain will come and go, and it is not that severe,
Okay.
and it will be there for months. And some patients may pass pus in the
Hmm.
urine, or some patients will have blood in the urine. They don't have the typical renal colic type of pain. They
Hmm.
don't
Hmm.
have. So you are having fever, urinary infection, blood in the urine,
Hmm.
pus in the urine,
Hmm.
vague pain, back pain, which is not
Hmm.
going off. Then we should
Okay.
suspect.
All right. Thank you, doctor.
Yeah.
We have Bhavesh Mittal with us, and whose question is, how does aging affect the prostate, and what changes can I expect in terms of its functions or size?
Yeah, and I told you earlier, with age, the prostate size will increase. It's something to do with the testosterone levels in the body,
Hmm.
and as like how the frontal hair will recede,
Hmm.
how you get your hair get
Hmm.
whitened,
Hmm.
graying of hair is there.
Hmm.
Prostate will also increase.
Hmm.
Not every person with prostate enlargement will have problems.
Hmm.
Okay,
Yeah.
if your prostate size is more, if you are getting frequent urination, that means you are passing urine number of times day and night. If you are getting urgency, and
Hmm.
then we have to do an ultrasound to look for the size of the prostate.
Hmm.
Yeah.
Thank you, doctor. We have Ankit Chaurasia with us, whose question is, are there any specific precautions or recommendations for maintaining overall well-being while considering prostate health?
Okay. Like for anything, healthy diet, exercise, and good. amount of water intake is the main key thing. Okay. So maintain ideal body weight, do exercise regularly. And for the prostate, no, yes, the prostate
Yes.
dietary recommendations are there, but I don't think they're seriously they can affect you. It's there that high fat diet may promote prostate enlargement, but this is a bigger thing, bigger factor for prostate enlargement. Okay, so but overall, you diet and exercise are the good things which will prevent not only prostate but any other problems. You all know that. Yeah.
Doctor, what takeaway advice would you like to give all our viewers?
So I tell you, you have a personal mug of water, have a personal bottle, and have a check on how much water you take. Okay, eat healthy, avoid refined sugars, avoid high protein diet, reduce your salt intake. Okay, choose what you eat. You are what you eat. You are what you eat. Okay, so remember that and do at least 30 minutes of exercise daily. That's all.
Thank you so much,
Okay.
Dr. S. N. Satya Prasad, for your valuable time. It has been very informative session for all our viewers. We look forward for many more such sessions in the coming time. Thank you, viewers, for your excellent participation. For more information and updates, stay connected on our FB page, Prostate Wellbeing. We are also available on YouTube, Twitter, and Instagram. Thank you. Have a great day ahead and take care of yourself.
Thank you.